All right, you guys, I want to show you today how a Cook catheter or balloon catheter works in induction. We get so many questions about induction, and sometimes it's just nice to get a visual of what it actually looks like. So I wanted to show you today how a Cook balloon works. I have one right here, and let me just get it out of the package. Here we go. So this is the actual catheter. It's in a sterile wrapper, and the procedure is done sterilely, so to introduce as little bacteria as possible into your vagina, into your uterus. So this is why it comes like that. And when we open it, we wear sterile gloves to do that, which we should for really most exams anyways, but some people don't. But for this type of procedure, we sure do. So let me just open this, and then I can show you a little bit more what this device is all about. Okay, so it's a really soft, flexible tube, as you can see here, and this is the end that will ultimately sit inside of your cervix or inside of the uterus, really. And here is that not inflated little balloon, and then there's a second balloon that sits on the outside of your cervix, putting counter pressure of that inflated catheter against the balloon that's hopefully helping the labor process along. Now there's 3 ports on the other end. One is labeled with an S that stands for stylet, and I'll show you that in a second. A stylet is essentially like a really long metal, not needle, but little, let me get it out of the device, like right here, like a wire. It's somewhat flexible, but stiff enough, and the midwife or provider will guide this stylet into that S tube, which then makes this catheter a little less flimsy, so it's easier to insert it, but then it comes out and we no longer need it. And then there's the other 2 ports. One is labeled with a U, and that stands for, maybe it's upside down, I'll show you this way, U for uterus. So that inflates that first balloon that sits inside of your uterus. And then there's one that is labeled V, it stands for vagina, for the vaginal balloon that's sitting in your vagina. So let me show you how this all works, okay? So during a cervical exam, this catheter will be inserted into your vagina, and then from there through your cervix. So you have to be at least 1 centimeter dilated for that to happen. And you could certainly do it without that stylet if it's easy to get to, but sometimes when the cervix is quite posterior, it's easier to have it a little bit stiffer, to get it to where it needs to go. So the first thing the midwife will do is thread that stylet into that middle port that's labeled S for stylet, and we get it all the way till the end until we meet some resistance here. And so now you already can see it's much more stiffer, right? And now it should be easier to thread it where it needs to go. So then with the one hand that the midwife uses for the exam, the catheter, the tip of the catheter is guided towards your cervix and then into your cervix and through your cervix about 1 inch into the uterus. And once it's in place, we'll take a sterile water-filled syringe and attach it to the port that's labeled uterus. And usually that's the nurse's job to do that. So the midwife will hold this in place gently and carefully, and then we test it to make sure it's in the right place by inflating. And here I'm just going to push some of that fluid in here so you can see it. Inflating that first balloon, and that's already our test whether or not it is in the right place. So now we should not feel this balloon outside of your cervix because it's through your cervix and inside of your uterus. And I'm going to fill that syringe a little bit more so I can show you how much bigger this balloon can get. This actually can hold 80 cc's or 80 mLs, which is so much. It's a really big bubble. This is only 10. And then here is 20. Just for funsies, I'm going to do it all the way till 80 because it's pretty massive, you'll see. And so essentially, oh, I touched it to the wrong port. There we go. Here comes 30. So once it sits inside, inside of your uterus, right on top of your cervix, the idea behind it is essentially that it should produce the same amount of pressure on your cervix that your baby's head would do. Okay, so this is 40. Okay, I'm going to do all the way till 80. Here is 50. As you can see, it's getting quite large. 60. So what does it feel like while it's being inflated? If it's in the right place above the cervix, I don't know that the woman, besides the hand inside there, and an exam is, certainly not the most comfortable thing, but the balloon itself at this point shouldn't create too much pressure because it's just still sitting there pretty loosely. But some women will certainly feel pressure, when that is inserted. And we want to hear from you. We want to hear, like, what are you feeling? Is it tolerable? Do you need us to stop, pause, whatever, right? So don't be shy about that. Here is 70. Okay, there you go. Quite big, okay. And just for funsies, I'm going to go to do the full 80. Typically in my practice, I don't do 80. I usually do 60 because I think that's enough, and I don't think there's any benefit in going bigger than that. But here is 80, you guys. This is how big this balloon can get. Okay, then we fill. So this is now in place, and to keep it there and not just bounce around in the inside of your uterus, we will inflate the vaginal balloon. So we use the green port labeled with V, same thing, attach a syringe with some sterile water and inflate that second balloon. Here goes. Okay, so this is 10. I'm gonna do, let's just say 40 because I don't think we need it to be the same size. Here is 20. $30. I'll do 10 more so you can truly see what this thing is doing. Okay. Twist it on. And 40. Okay. There. So now this is sitting in the inside of your uterus, on top of your cervix, the same place where your baby's head would go, putting pressure onto the cervix. This one is putting counter pressure from below so that this thing stays in place until, through you having contractions and cramping and all of that stuff, the cervix softens, shortens, dilates. The midwife will take out that stylet. So nothing sharp, nothing hard, nothing firm in there besides this device. So at the time when truly things are happening and labor is kicking in and you're dilating, if you are, so this diameter is about, I would say, 4 to 5 centimeters. If you reach that dilation, this balloon will then slip out, through the cervix, and it'll be sitting in your vagina, and you probably will feel it, as in like, oh, something is coming out. What is that? It is this very balloon. And so now when that happens, we pretty much can feel pretty assured that you're about 4 to 5 centimeters dilated. If that doesn't happen, this balloon can stay in there for 12 hours. And if it hasn't fallen out at that time, then we do the whole process in reverse. We use the syringes, attach the syringes, deflate the balloons. I'm not going to do this whole thing now because it just takes too long. but you get the point. Both balloons get deflated to where all of the fluid comes out and it's no longer, a bubble. And we make sure we write down with how much we filled it so we know how much to take out, so we don't, try to pull it out and the bubbles are still there and hurting your cervix in the process. So there'll be documentation on that. Anyways, so if it falls out on its own, great, then you have made great progress in your induction, in your labor induction, and your cervix is dilating. If in 12 hours nothing has happened, or at least not to the point where you're the 4 to 5 centimeters dilated, maybe a little bit less, it'll be removed, it'll be taken out. That process does not hurt. If anything, probably feels like good relief. Now, putting it in, some women really don't like it. They're really painful doing that. Some women will use pain medication to put it in. That helps them relax and just get through the process, a little bit more comfortably. Typically, once it's in place, most women will kind of settle into that place, feeling like, okay, this wasn't so bad, and it's manageable, and it's for a good purpose, like, hoping that labor will progress from here on out. But make sure you tell us what you're feeling. If you do need pain medication during the procedure, putting it in, or also taking it out at any point, even if it's before the 12 hours, because you just can't tolerate it for whatever the reason is, let us know. Please talk about it, okay? So it's not, you're not alone in what you're feeling. Anyways, so this is a Cook catheter. So I hope that, that helped answer some questions, and that visual helps kind of picturing of what's happening. Your provider may or may not offer that to you. Some providers really don't like using balloons in the induction of labor. Some are big fans of it. It's very much provider preference, and certainly, they should talk to you about risks, benefits, alternatives, and get your input of what that is that you want to do in your labor. All right, I hope that helps. You guys have a great day.